Hello, PsychU community. Thanks so much for attending today's program, Addressing Racial Disparities in Healthcare for Black Americans, Bridging the Gap and Changing the Trajectory. So today's program is sponsored by Otsuka and Lundbeck. The speakers are paid consultants, and I'm an employee of Otsuka.
Well, racism is not biological, although popular discourse and even some medical journalism treats it as it is. It's not biological, but it's very, very real. It's real because it's a powerful mythology that's created a very powerful social construct that has become an American obsession. Race races are profoundly different, and there's a hierarchy to human organization. That's the philosophy that racism is built on, but it's not true. We know that the biological difference, the biological dimorphism, is a product of mythology. But this hierarchy is the root of many, many problems, as historically, for 4 centuries now, medical science has constructed a hierarchy in which people of African descent who are dark skinned consistently fall to the bottom, considered less intelligent, even less virtuous, with profoundly damaged or bodies, with very powerful differences in diseases they suffer from, diseases that they're immune to, their behaviors, their psyche. All these things are held to be different because of physical differences, but actually, it's a mythology that has created difference where it didn't exist and actually created differences in disease vulnerability, not because of our bodies are created different, but because we're treated differently.
Well, yeah, I think that it has a very important role. We recognize that the novel coronavirus is an impactful event for the world, but it's more impactful in terms of African Americans, both in terms of increased risk of getting the virus, dying from the virus, dying from it because African Americans are much more likely to have comorbidities that were undertreated, again, because of the lack of health care available based on institutions that dispense health care in terms of race and in terms of access to care. Many African Americans are afraid to go get treated because of a history of scientific racism that's perpetuated by sometimes using African Americans as subjects when there's not being aware. And of course, the well-known case of the Tuskegee Experiment, in which the natural course of syphilis was examined in African Americans before they had reliable treatment. And when treatment became available, the patients simply weren't told about it.
There's several things that come to mind when specifically with regard to HIV, and I want to have Harriet comment on this. In the early days, there were some studies done that it was very racially biased and caused treatment of HIV positive African Americans to get far behind their counterparts in other races. Also, when I was a resident back in the 70s, there was this general belief that permeated the profession that bipolar disorder was a disorder of upper middle class white patients. And at the University Center, there was this an acronym called YAVIS, and it was Young, Verbal, Intelligent Student. And those tended to be the people that got a bipolar disorder. And that bipolar disorder patients would spend a lot of money and they would buy things. But as I had went to my first position after residency at a clinic in a socioeconomically deprived area, you start to see that not only African American patients, but patients who don't have economic means to be able to buy cars and take expensive vacations, their mania looks different. It doesn't mean that they're not bipolar, but they get arrested because they're climbing telephone poles and waving, knives and things in the street.
We got recognition that there are many people that came here voluntarily, immigrants who came from Africa and other places. But African Americans, the largest percentage of us are unique. We came here involuntarily. And not only we come here as involuntarily, we came in here as slaves, which had a unique position in the world at the time. Slaves were either three-fifths of a man or not humans at all. We were property, and as a result, did not and they were subject to whole different rules in terms of care and training.
You know, it's interesting, and I'd probably want to defer to Harriet about this because there are people in the country who are Black but identify as Hispanic. Let's say our neighbors to the south from the Caribbean, who would tend to probably, from most of the countries of the Caribbean, would tend to identify as Hispanic or Latin in many of those countries. Um, so it's been a debate about, you know, I was looking back at my gift in my birth certificate, I was colored. And then I think we became Negro, and then we became African American, then we became Black. And I think the Latino community has gone through a similar naming sort of confusion.
And Harry, you know, I would actually like to invite you to maybe jump in and share some thoughts. Uh, so, given that context, are you able to maybe share some thoughts on what the implications are to COVID?
One very large implication is that environmental racism, the effects extend far beyond the usual acknowledgments. A lot of the popular focus is on things like cancer, lung disease, very important, but I have addressed the cognitive problems. Um, Many of these heavy metals, industrial chemicals, even pathogens have direct effect on fetuses and young children, deranging their brain development, resulting in both mental illness and lower intelligence, other cognitive effects that only manifest decades later when they become an adult. And when they become an adult or an adolescent and begin showing behavioral problems, it's very hard to tie them to the arsenic they were exposed to in utero, or the fact that they grew up across the street from a toxic belching bus depot. But these are all important factors, and the coronavirus, it's very direct. There is no risk factor caused by environmental racism that does not contribute to coronavirus vulnerability. Um, I was astounded to see that every single one of them did. I mentioned air pollution earlier. I mentioned vitamin deficiency, but even things like growing up in neighborhoods, these food swamps, I like to call them. They not only are devoid of affordable, nutritious food, but they also are chock full of dangerously potent forms of tobacco and alcohol. So all these things conspire to create, among other things, COVID-19 vulnerability. I think, and environmental racism is something that is very controllable.
When the problem of drug addiction became one of opiates and Caucasians died, it got a lot of attention, a lot of concern. When African Americans died in large numbers in the past, it was ignored. Similarly, we see the same thing happening now, and we have a tremendous opiate epidemic in which African Americans are dying in large numbers. But again, it's being ignored.
Yeah, well, just to go back to a couple of points that you made me think about, talking about violence right now. Clearly, there's evidence that now we have people more together during lockdowns and coronavirus restrictions. So we have abused women that are now in the house with their abuser, and they don't have the opportunity to escape the way they used to. So domestic violence is up. I have a patient who's Asian whose mother was attacked because she was felt to be a vector of the transmission of the coronavirus. And it's kind of interesting that, and I saw an interview on television with the Blackstock twins, and they were talking about this. One is an ER doc and the other is an HIV specialist. And it's as if a member of a minority group, if they do something, particularly something that's perceived as negative, it's attributed to the entire group.
Right.
Whereas if someone from, let's say, a white a person does it, it's not attributed to all white people. So it's interesting that you always seem to carry the banner for your entire group if you're a minority. But to go back to the opiate issue, it's interesting historically, particularly with Harriet's perspective, this historical perspective that we're getting, is that there was a medication that became available to treat opiate dependence. It's very novel and everybody knows what it is. It's an improvement on the old medication that was used in regulated clinics. And in the beginning, people who prescribed this drug were villainized. The FBI or agents of the DEA would literally drop into your office and treat you as if you were some type of a criminal. As recently as last month, and then you had to get a special license to prescribe this medication. As recently as last month, anyone can now prescribe it with their own DEA number. So it shows you sort of this evolution in medicine from things that we kind of thought were terrible to now we're being begged to do things because we're now in a crisis. So there are these fluid things that keep happening that make you kind of scratch your head.